Hi, my name is Sam Sunshine, and I've been given the audacious task by my marketing team to come up with some recommendations for screening mammography for detecting breast cancer. And the reason I'm saying it's an audacious task is I'm trying to keep it short and sweet and to the point. The problem is it's very controversial. Mammograms are not as clear cut in terms of when to start screening, how often to screen, and when to stop screening using mammograms, or mammography is the term we use. And so, what are some key points? First of all, breast cancer is the fourth leading cause of cancer in the United States. And it's the most common cancer type in women. And there is more scientific evidence related to screening for breast cancer than any other cancer. However, with mammography and with breast cancer therapy, we haven't made significant gains in reducing the death rate from breast cancer. And let me rephrase that by quoting Dr. Siddhartha Mukherjee, who is the author of a book called The Emperor of All Maladies, a biography of cancer. He said that screening mammography probably reduces breast cancer death rate by about 12%, and that chemotherapy treatments, including Herceptin, which is a breakthrough drug, has also reduced breast cancer death rates by about 12%. So about 1 in 8 women in the United States will develop invasive breast cancer over the course of her lifetime. That's pretty significant. And that's one of a woman's biggest concerns, is developing breast cancer. So what about the benefits and the potential harms of screening mammograms? So let's talk about the benefits. Certainly for a woman who's at average risk, this is a woman who doesn't have first degree relatives with breast cancer, hasn't been exposed to radiation, they're going to be at average risk. And if you're between the age of 50 and 74, then every other year or biennial screening mammography has been shown to be beneficial. If you do increase that to annual or every year mammography, then the false positive, that means you get diagnosed with breast cancer when you really don't have it, goes up to 45%, which is too high in my mind. Okay. And again, there's limited data as to how much of a reduction in mortality is seen over time that is attributable to advances in imaging techniques, which is mammography now is 3-dimensional, and tomosynthesis, you have much better clarity. And how much is due to improved effectiveness of therapy. And again, like I mentioned, therapy has come a long way. All right, so what are some other thoughts? I want to talk about the harms of mammography. And so most people would say, what do you mean, Dr. Sunshine? What are some harms of mammography? Well, the problem is that breast cancer screening include the potential for false positive findings, as I mentioned before, especially in younger women between 40 and 49. There's patient anxiety. There's overdiagnosis. This is diagnosing a woman with breast cancer when she doesn't have breast cancer, and unnecessary treatment and the associated risk with unnecessary treatment. And I'll be honest, the risk of harms is substantial. We'll talk about that. So with overdiagnosis, this occurs when screening leads to identification of breast cancer that has not been caused, overdiagnosis occurs when screening leads to identification of breast cancer that would not have caused clinical consequences in a woman's lifetime had it not been detected. So put that another way is that you get a breast cancer that's detected that probably wouldn't have been of any consequence, because maybe it's something that's considered stage 0. For instance, the estimates for overdiagnosis in breast cancer range from 10% or less to over 50% of all women diagnosed with breast cancer. Several studies have suggested that many cancers, especially those confined to the mammary ducts or DCIS, ductal carcinoma in situ, are biologically insignificant and would never become clinically evident in a patient's lifetime. So what about false positive mammogram result? So for each woman whose life is saved with mammography, many women will experience false positive mammograms. Most recently, an observational study of the effects of screening in the United States over the past 30 years suggests that 50% of screen-detected cancers represent overdiagnosis. And that while early stage cancer diagnoses have doubled, advanced stage breast cancer is about as common today as it was before mammography was in widespread use, which in my experience has been the entire time I've been practicing medicine. That's been close to 30 years. So again, despite substantial increases in the number of cases of early breast cancer detected, screening mammography has only marginally reduced the rate at which women present with advanced cancer. So I just wanted to state that again. So what are some things you can do to prevent breast cancer? Well, first of all, a healthy plant-based diet that includes cruciferous vegetables like cauliflower, broccoli, green tea, and other polyphenol-containing foods, healthy fats, fruit and whole grains, skipping the soy, vegetable oils, fruit juices, and sugary foods can improve or reduce your risk of breast cancer. Alcohol consumption can be associated with breast cancer risk. Compared to women who don't drink at all, women who have 3 alcoholic drinks per week have a 15% increase risk of breast cancer. The estimated alcohol and breast cancer risk increases another 10% for each additional drink women regularly have each day. And this is according to breastcancer.org. So again, eating organic, fresh foods as much as possible. Avoiding canned foods and drinks. Most of these cans contain bisphenol A or BPA, which is a toxin, and it has been linked to hormonal disruption and breast cancer in mice models. Exercise. So in my literature search, there's many studies that link a reduction in breast cancer mortality in women who exercise regularly. So again, an inverse relationship with breast cancer and exercise. And new studies suggest that activity during adolescence is the most important for premenopausal breast cancer reduction. So another modifiable risk factor is smoking. So smoking is associated with breast cancer. Also, body mass index. So the higher your body mass index or your weight relative to your height, there is an increased risk in breast cancer as well. So again, in summary, some of the recommendations for screening for breast cancer is that if you're at average risk for developing breast cancer, which is the majority of women, that getting a mammogram every other year or biennial between 50 and 74. And then try to limit your alcohol intake, exercise regularly. If you do smoke, stop smoking, and eat a healthy diet. So I hope these things help. Again, this is a heated topic of breast cancer screening, and I don't think women understand some of the potential harms that go along with breast cancer screening, and it's not something to be taken lightly. Thank you for listening.